Hi, my name is Courtney Murphy and I am with Prevent Blindness Wisconsin. Today we're going to talk about children's vision health and the importance of vision health for kids as they grow and develop. A little bit about Prevent Blindness Wisconsin. Prevent Blindness Wisconsin is a nonprofit organization located in downtown Milwaukee, but we service the entire state of Wisconsin with preventative vision health services. And it's not just for children's vision health, it is across the lifespan, all the way from newborns to older adults. A little bit about Prevent Blindness Wisconsin's partnership model. Our partnerships really allow us to reach hundreds of thousands of Wisconsinites every single year. So we train and certify school nurses, university students, high school students, free and reduced clinics, community health workers as certified vision screeners to go out and vision screen children and adults in their community. Prevent Blindness Wisconsin really wants to raise awareness in regard to vision health for all ages. With our preventative vision health services, they really range. Our bread and butter program is going to be direct vision screenings for both children and adults, checking their visual acuity, risk factors for a possible vision problem, but we also rely heavily on raising awareness of vision health as well, going in regularly to the eye doctor as needed, no matter what the age of the person. But today we are going to focus on children's vision health and the importance of healthy vision as they grow and develop. A little bit about vision health in Wisconsin though, specifically for children. Wisconsin is actually one of 9 states that does not require vision screenings for preschool or school-age children. That is why it is so important that our partnership network is out vision screening regularly for children in Wisconsin. On a more national scale, in the U.S., less than 70% of children are receiving regular vision screenings or eye exams. When it comes to vision concerns, many children are not aware that they are seeing the world differently. They think the way they see the world is how everybody else sees the world. It's not until they put on that pair of glasses and we hear very commonly, "Oh, I didn't know trees had individual leaves." So a little bit on statistics and the need when it comes to vision health for children in Wisconsin. 1 in 5 preschool-age children, including Head Start children, and 1 in 4 school-age children has a vision problem. We are seeing those rates increase as well. And a lot of that does have to do with an increase in screen time use for kids, especially at younger ages, and children not getting outdoors as much in the sunlight. When we think of vision concerns in children, a lot of times we think of it affecting their academic performance, and it definitely does. But it also affects a lot of other areas of their well-being and quality of life too. Vision concerns can affect their self-esteem, mental and emotional health. Some children may act out because they know they can't see as clearly, and that's when we can get into more of the behavioral concerns for some children too. Athletic performance can be affected by vision concerns too. A lot of times if kids are not seeing as clearly, their depth perception is off, and we do have some vision concerns that can lead to permanent vision loss in some children as well. So next we're going to talk about the difference between a dilated eye exam and a vision screening for a child. So when it comes to children's vision screenings, really what we're doing here is we're identifying those more at risk for a possible vision problem and then referring them into care with an eye care provider. With the vision screening aspect too, we really want to raise awareness and educate families on the importance of children's vision health and how it can change over time as they grow and develop. If a child does go in for an eye exam, we do want to make sure that pupil is being dilated. The act of dilation really allows that eye doctor to look into the eye and see all of those structures magnified. If we don't dilate the pupil, a lot of times we can have a little bit more of a narrow snapshot and we may miss a diagnosis for that child as well. If a child is referred from a vision screening at school, at their child care center, even in a clinic setting, best practice is to make sure that they get into care with an eye care provider. Currently in Wisconsin, vision screenings are not required for preschool or school-age children. So school districts, child care centers are not required to offer vision screenings. However, when it comes to Head Starts throughout Wisconsin, they are required to conduct vision screenings for all students in their care. These need to be conducted within 45 days of enrollment for that child into that Head Start program. Head Start really is that only mandatory vision screening entity that we see in Wisconsin, and that is due to it being that federal organization. When it comes to children's vision screenings, Prevent Blindness Wisconsin's main area of focus is our preschool age population. A lot of times when it comes to children's vision concerns for preschool age children, we can't physically see that vision concern. During the ages of 3 to 5 years old, that's that critical growth period for a preschool age child. The eyes grow and develop rapidly, and sometimes we may not see that vision concern pop up until they are 4 or 5 years old. For some children, they may pass their vision screening at age 3, but at age 4 they don't. Vision screening often and vision screening early does allow vision problems to be caught at a more early and treatable stage for children. Children that are younger than 3 years old, though, should receive those regular vision screenings at their annual physical or well-child checkups as well. Currently in Wisconsin, we are seeing that vision screening referral rate rapidly increase. As previously mentioned before, a lot of it has to do with an increase in screen time for kids, but also too, kids not getting outside as much. Sunlight helps their eyes grow and develop, and it actually releases dopamine in their body, and that helps those eyes grow and develop like they should. If a child is referred from their school vision screening, center vision screening, or even in a clinic setting, it is extremely important that they receive an eye exam from an eye care provider. In some cases, age of the child can raise concern for getting that dilated eye exam. No matter what age that child is, they should be referred to an eye care provider to make sure their eyes are healthy as they grow and develop. It can be difficult to find a vision clinic that conducts dilated eye exams for preschool age children. However, they do exist. There are vision clinics throughout Wisconsin that do provide eye exam services for preschool age children, and Prevent Blindness Wisconsin is here to help families find them as well. When it comes to a dilated eye exam for a preschool age child, a lot of times there are concerns on what if they don't actively participate in that eye exam? What if they are a little bit too shy to engage, or they don't know their shapes yet fully? That's okay. They do not have to actively participate or verbally speak on what they are seeing. A tool used to obtain an accurate eye exam for a preschool age child is a retinoscope. This is a light that is shined into the child's eyes and allows that eye doctor to see how light is reflected off their retina, and that gives them that accurate refraction. With this to help engage the child during this process, they can show finger puppets to them, play movies in the background. They have spinning toys that light up as well, so they do make it fun for the child as well. Next, we're going to go over those common vision concerns we do see in children, preschool and school age. The most common vision concerns we see in children is refractive errors. Refractive errors are a defect in how light enters our eye and reflects on our retina. Refractive errors are myopia or nearsightedness, hyperopia or farsightedness, and an astigmatism. Refractive errors can occur due to the shape of the child's cornea, or a lot of times it has to do with the shape of their eye itself. So some kids may grow out of a refractive error such as hyperopia or farsightedness as they grow and develop. When it comes to myopia or nearsightedness, we are seeing cases increase throughout Wisconsin. And this has to do with that increase in screen time use and kids not getting outdoors as much. There are vision concerns out there, though, that can cause permanent vision loss in a child if we do not detect and treat them early. And that includes strabismus or crossed eye and amblyopia or lazy eye. When it comes to strabismus, this is where the eyes do not properly align. So in children, we typically see the eye or eyes turn in or out. And for adult onset strabismus, we typically see the eyes turn up or down. For strabismus or crossed eye, we have about 5% of the preschool population that is diagnosed with strabismus. With strabismus or crossed eye, if it is not detected and treated early, it can lead to a more serious vision concern known as amblyopia or lazy eye. Amblyopia or lazy eye is also known as dull vision in a child. Essentially, how we see things is the brain takes the two images that our eyes see and puts them together. With amblyopia, one eye typically is seeing clear and the other eye is not. So you have such an unequal image quality, it's hard for the brain to take those two images and put them together. So over time with lazy eye, the brain actually shuts off connections and signals to that blurry eye and just does the seeing out of that clear eye. This can lead to permanent vision loss in that child if we do not detect it and treat it early. With amblyopia, this is present in about 1 to 3% of our preschool population, but it is actually the most preventable cause of vision loss in a child. And that is why we really strive and stick behind the motto to vision screen often and vision screen early for preschoolers, because a lot of times amblyopia is not physically seen. Next, we're going to get into vision screening protocol for newborns all the way up to 18 years old. Prevent Blindness Wisconsin's Children's Vision Screening Protocol is approved by the National Center for Children's Vision and Eye Health, and that includes all of our chart-based methods, which include the eye check booklet for our preschool age population, as well as the Sloan Wall chart for those school age. The vision screening methods and protocol we are going to go over today also follow the recommendations of the American Academy of Pediatrics and the American Association of Pediatrics for Pediatric Ophthalmology and Strabismus. First, we're going to start off with how we vision screen newborns to just up to 12 months. Vision screening protocol recommends using the vision milestones for newborn babies. Vision milestones is observations that we see as a child grows during that first year of life. There are 18 key developmental milestones that we want to look for to make sure those eyes are growing and developing like they should. Vision milestones can vary up to 6 weeks for each child, but it is a great tool to really monitor and measure their progress as they grow. Children just over a year to 48 months are vision screened using an instrument-based tool. And instrument-based tools really are designed to detect for amblyopic risk factors as well as pupil abnormalities. Instrument-based tools can include the Spot, the Plus Optics, or Go Check Kids. When it comes to vision screening a toddler with an instrument-based tool, a lot of times that child is either seated on the parent or caregiver's lap, or we can hold them over our shoulder as well to get a good view in our instrument-based tool of the child's eyes. Dependent on the tool, the vision screening distance is typically about 3 feet. When it comes to our instrument-based tools, we also find that conducting them in a darker room can really help pick up on the child's pupil sizes to get a more accurate vision screening. During the vision screening, both eyes are kept open and a picture is taken of the child's eyes. From that picture, the device will tell us if they are a pass, a refer, or if we need to conduct the vision screening again. When it comes to vision screening a preschool-age child, so those 3, 4, or 5 years old, there are 2 approved vision screening methods. The first is monocular measure of visual acuity, which is our chart-based method, or our eye check booklet. The eye check booklet is designed to pick up on amblyopic risk factors, but it also tests a child's visual acuity. The second approved method for vision screening is an instrument-based tool. So that is our Spot, Plus Optics, or Go Check Kids. But the main difference here is that instrument-based tool only is designed to pick up on amblyopic risk factors and pupil abnormalities. It is not designed to test a child's visual acuity. That is the main difference between the iCheck booklet and an instrument-based vision screening for a preschool-age child. The iCheck booklet is considered gold standard because it does test a child's visual acuity as well as detecting for those amblyopic risk factors. With the iCheck booklet, what we do is we review our LAIS symbols with the child before that vision screening begins. This just helps them with consistency and to get them used to what they're going to see in the booklet during the vision screening. We do have a lap card that they can use to identify the shapes they're going to see. They can either verbally say the shapes, or during the vision screening they can simply point to what they see as well. The iCheck booklet is a 5-foot testing distance. We do start with both eyes open for the child. And we actually start at a visual acuity of 20/80 with both eyes open. This again just helps them get used to the process, what they're going to see during the vision screening, and it is really difficult for a preschool age child to go right into our passing size for visual acuity. After we go through the designated pages of the booklet with both eyes, we are then going to start to vision screen each eye individually. We start vision screening the right eye first, occluding the left, and then vice versa. When it comes to the visual acuity size, the iCheck booklet has 2 different booklets, one for 3-year-olds and one for 4- and 5-year-olds. The 3-year-old booklet tests them to a visual acuity of 20/50, and the 4- and 5-year-old booklet tests them to a visual acuity of 20/40. The child will identify 4 shapes with the right eye independently and 4 shapes with the left eye independently. When it comes to instrument-based vision screening for a preschool-age child, the Spot, the Plus Optics, or Go Check Kids can be used. This is a 3-foot testing distance for the child, and with the instrument-based tool, we typically like to be in a darker room. The tool is designed to take a picture of the child's eyes and focuses on that pupil size. If the child's pupil is smaller, it's harder for the camera to pick up and get an accurate vision screening. That is why we recommend being in a darker room, pulling the blinds in that vision screening location, or even having the child wear non-polarized sunglasses can help those pupils dilate. Also, wiggling their toes. It's a fun tip to get them engaged, but also it releases a basal response in their body, and that actually helps their pupils dilate as well. Once that tool gets that picture, it will tell us if the child is a pass, a referral, or if we need to vision screen them again. Sometimes, if the tool cannot pick up on that pupil size, or if the child is moving during that vision screening, it may tell you to rescreen them. Prevent Blindness Wisconsin recommends rescreening that child up to 3 times, and then if we still can't get that accurate vision screening, to use that iCheck booklet as that second attempt. When using the instrument-based tool, there is an option to print off results from that child's vision screening. Prevent Blindness Wisconsin trains all of our certified vision screeners and highly recommends to not share those results with families. The printout of results the instrument-based tools produce is not an accurate diagnosis. At the end of the day, if a child is referred from their vision screening, we want to make sure that they are getting into care for a dilated eye exam. Next, we're going to get into how do we vision screen our school-age students. So that is those that are 1st grade and older. To vision screen our school-age students, we use the Sloan wall chart. The Sloan wall chart is approved by the National Center for Children's Vision and Eye Health, and the sole purpose of the Sloan wall chart is to measure a child's visual acuity. So very similar to the iCheck booklet, the iCheck booklet had the features to test a child's visual acuity. The Sloan wall chart does the same thing, just for those older. With the Sloan wall chart, we do vision screen each eye individually with an occluder paddle, or the child can wear occluder glasses during the vision screening as well. I do want to pause and make note that the Sloan wall chart is the only approved vision screening tool for school-age students. The instrument-based tools such as the Spot or the Plus Optics are not approved for school-age students. Due to them being designed just to test for amblyopic risk factors and pupil abnormalities, they do not test for a child's visual acuity, and that is our sole purpose when it comes to a school-age vision screening. When it comes to a school-age vision screening with the Sloan wall chart, this is a 10-foot testing distance. Each eye is individually vision screened, and the child is vision screened down to the passing line, which is the 2032 line. They must identify 3 out of 5 letters on the 2032 line to be passing in either eye. If we do have a child that does struggle with their letters, we can actually flip the chart over and use the shapes on the back side as well. Next, we're going to get into the ABCs of children's vision health. These are warning signs that we want to be aware of and look out for as a child grows and develops. A stands for appearance of the child's eyes. Do they look healthy? Is there anything abnormal that's standing out to us? Abnormal would be, do the eyes continuously water? Is there an unequal pupil size? Does the pupil appear white instead of black? Do we notice any bruising or injury around the eye? Any infections along the lash line? A drooping eyelid? Maybe a wandering eye in one or both eyes? If we notice any of these during a vision screening, in school, at home, we would refer the child for a dilated eye exam. B stands for behavior. So how is the child behaving at school, at home, doing activities that they love doing? Warning signs of behavior would be if a child would be squinting, tilting their head to one side. They may get really rigid trying to see something in the distance. They may ask to be moved up in the classroom to see that whiteboard or smartboard. Maybe they hold a book really close to their face. They may excessively blink as well. If we notice any of these behavior signs, we would want to refer them to an eye care provider for that dilated eye exam. C stands for complaints. Is the child complaining that things are blurry? Maybe they are getting headaches more often than usual. Do they have an unusual sensitivity to light? Are the eyes burning, itchy, or scratchy? These are all complaint signs that we would refer that child in for a full dilated eye exam. Next, we're going to get into navigation to vision care. So if a child is referred from their vision screening, the steps parents and families can take to make sure they are able to be seen by an eye care provider. There are a couple components that can influence a child getting into further vision care. That has to do with the family's vision coverage, if they have any vision benefits, but also to the age of the child. Families are encouraged to make an eye exam appointment with an eye care provider that is covered under their vision benefits if applicable. This could be an optometrist or an ophthalmologist. Prevent Blindness Wisconsin has a variety of resources available for families to navigate the vision care system and make an eye exam appointment. This includes if they have state insurance, Medicaid or Badger Care, private vision insurance, or no vision coverage at all. When it comes to Medicaid or Badger Care, Medicaid does cover an eye exam, a pair of glasses, and 1 replacement pair of glasses every year for children and adults. If a family does have Medicaid or Badger Care coverage and they are making an eye exam appointment for a child that is between the ages of 3 to 5, it is extremely important for them to find a vision clinic that offers and provides those vision health services for preschool age children. If they do struggle finding a clinic, Prevent Blindness Wisconsin is here to offer assistance and provide resources to help families get to care. For families that don't have any vision benefits, there are resources out there to get referred children into further vision care. If you have a family that is struggling to access further vision care, please contact Prevent Blindness Wisconsin. Our team is working to close gaps to vision care for preschool, school age, and adults throughout the state. We want to make sure accessible vision care is available to all Wisconsinites. Next, we're going to get into specialty vision care. If a child goes in for a dilated eye exam and they are diagnosed with a medical condition, they need to be monitored by an eye doctor regularly. Conditions that include specialty vision care include, but are not limited to, amblyopia or lazy eye, strabismus or crossed eye, any additional vision concerns that require surgery of one or both eyes, pediatric glaucoma, retinal disease or retinal detachment, and retinopathy of prematurity. Children diagnosed with a medical condition should be seen regularly by their eye doctor. That regularity is going to be determined by that eye doctor, and with these visits, it is used to monitor the health of the eye and also see how treatment is progressing or regressing. Next, we're going to get into how to become a certified children's vision screener. Prevent Blindness Wisconsin is the only entity in the state that offers children's vision screening certification courses. The certification is valid for 3 years. There are several training options for you or your staff to become a certified children's vision screener. Prevent Blindness Wisconsin has a variety of training options, and these include a live Zoom training that happen monthly. There is an asynchronous children's vision screening training video option, or we can schedule an in-person training with your clinic. An in-person training option does require a minimum of 10 people to be in attendance. To become a certified children's vision screener, it does not take long. The training lasts approximately 2 to 3 hours to become a certified screener for 3 years. Our in-person training option is approximately 2.5 hours in length. However, we can adjust that time if clinics need it to be completed in an hour or a certain amount of time for staff. For our online training video, that takes approximately 1.5 hours, and our live Zoom trainings that happen monthly take approximately 2 hours to complete. The last section we're going to touch on today is vision health resources for families that you serve. Prevent Blindness Wisconsin has a variety of vision health resources and education to raise families' awareness on their child's vision health. These resources include the ABCs of vision problems in children, common vision concerns that we do see, county eye care provider guides to help families navigate the vision health system no matter where they are in the state, how to make an eye doctor appointment navigation with Badger Care and Medicaid, screen time awareness and taking time off of screens for children's vision health, vision milestone fact sheets and video clips for new parents or parents of newborns or caretakers, and how to get into further vision care if a child is referred from their vision screening. I do want to take a moment and put a focus on digital devices and how they affect our eyes over time. This is for kids and adults. They say by the year 2050, half of the world population will have myopia or will be nearsighted. There are a lot of effects that digital devices can have on our eyes, but also our body in general. To break up those hours of the day in front of a screen, we encourage doing the 20-20-20 rule. So after 20 minutes of looking at your phone, your laptop, even doing near work if it's homework or reading a book, we encourage you to look up and look at an object that's at least 20 feet away for 20 seconds. That helps the eyes reset themselves and allows you to use your distance eye muscles. When we're looking at a screen or even reading a book, we're using our near eye muscles constantly. So to engage those distance eye muscles can help with that onset of myopia over time. Recently, Prevent Blindness Wisconsin created a public health campaign to raise awareness on screen time and the eyes for children. It's called Kids Take It Outside. The website offers a variety of resources and education and activities for kids to do to put down the screens and encourage healthy vision health habits. Prevent Blindness Wisconsin has a lot of resources for families that are going through different vision health treatments for their child. This includes if a child is patching or if they just received a pair of glasses. We have our eye patch club, where if a child is patching, they get a calendar sent to them, and for every day of patching, if they put a sticker on those days of patching, they send it back to our office, and we send a vision-related book as a nice incentive for them. We also have a lot of books that encourage the use of glasses for children to make them feel a little bit more involved and included as well. Prevent Blindness Wisconsin wants to thank you as providers and clinic staff for the service that you do for families throughout our state. Together, we can ensure children have healthy vision throughout their lifetime. For additional resources and support, please visit Prevent Blindness Wisconsin's website or give our office a call. We are here to help.